As we finished the previous annotated PowerPoint, I said that was the end of the axial skeleton. That shows you how dumb I am. Everybody out there, just go ahead and give yourself 1/1,000,000th of a point of extra credit for me being so incredibly dumb. But at the end of this PowerPoint, I'm pretty sure we are done with the axial skeleton. And if not, then you just get another millionth of a point of extra credit. Let's take a look at what we often call the thoracic cage, all right? Because it is a cage. It's a cage that holds your thoracic organs. What are your thoracic organs? You should know the answer to that. Do you know what cavities there are inside of the thoracic cavity? You should know the answer to that as well, all right? So remember the thoracic cavity, part of the ventral cavity. Within the thoracic cavity is the two pleural cavities and the mediastinum, and within the mediastinum is the pericardial cavity. All of those are within the thoracic cage. Why do we have a cage? Well, your heart's a pretty important organ. If somebody punches you in the chest, you wouldn't want them to punch through your heart. So we have a big giant sternum to protect that. And likewise, your lungs, you don't want somebody to punch you in the lungs because then you wouldn't be able to breathe. So the thoracic cage protects the heart and the lungs. Thorax refers to the entire chest. Thoracic cage is the bony cage flattened from front to back. It's got the sternum on the front and the vertebrae on the back. The sternum, also known as the breastbone, we have to know its technical name. This is a class in human anatomy and physiology. We have to know the technical names. When you're by yourself, a little Rona there. I'm just faking it. Out your friends, down at the Surly Wench or whatever, you go ahead and call it the breastbone, or when you're carving the turkey, whatever. But in our class, we're going to call it the sternum. The ribs, okay, ribs connect to the sternum. Some of them do, some of them don't. We'll see coming up. 1 through 7 are called true ribs, vertebrosternal. Why vertebrosternal? Again, look at the word. They connect the vertebrae to the sternum. True ribs because they go all the way from the vertebra to the sternum. Ribs 8 through 10 are called false ribs, vertebrochondral. Here's a good root word. Chondro means cartilage. So these connect the vertebrae to the cartilage. So look carefully at that diagram. Notice that ribs 1 through 7 actually do go to the sternum. Ribs 8, 9, and 10 kind of look like they go to the sternum, but they don't. They really just connect to the cartilage of rib number 7. That's why they're called vertebrochondral. They don't go to the sternum. They just go to the cartilage of rib number 7, vertebrochondral. Sometimes vertebrosternal are called true ribs. Sometimes vertebrochondral are called false. Again, when you're hanging out with your friends at Che's or, wherever, O'Malley's, you can go ahead and call them true and false, but in this class we're going to call them vertebrosternal and vertebrochondral. 11 and 12 are floating ribs. Floating, what does that mean? Well, they don't connect to anything except the vertebrae. They do not connect to the sternum or to cartilage, so they float, floating ribs. In martial arts, that's one of the places they tell you, use a tiger fist to hit to the floating ribs and you can puncture someone's kidney. Don't do that, kids. That's a very mean thing to do to somebody, okay? I mean, unless you're fighting for your life or something. Costal cartilage. So costal, another good root word, means rib. So notice how the ribs have cartilages on the end. Those are the costal cartilages. Just cement that in your head right now. Costal means cartilage. Always, 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 always. The bodies of the... Oh, I talked over the transition. It didn't matter. Never mind. Here we are on the sternum. Notice there's a line, what they call the sternal angle. I don't have that on your list. You don't have to know that from me. But above the sternal angle, that part of the sternum is called the manubrium. And below, that part of the sternum is called the body. So the manubrium connects to the first and second ribs, and it has the clavicular notch. The clavicular notch is the little place where the clavicle connects. The clavicle is your collarbone, okay? Then the body, all right, has costal cartilages of ribs 2 through 10. And the xiphoid process down on the very end. That's a little pointy piece of cartilage. It's cartilage in most of you. Turns into bone by the time you're around 40. I'm 70, so it's definitely bone in mine. It used to be in the old days, that was a landmark for doing CPR. They would tell you to find the xiphoid process and then go like 3 fingers up. And then put your hand on the body of the sternum when you're doing the chest compressions. They want you to do that because you don't want to do a chest compression on top of the xiphoid process because you may puncture the person's heart. And normally when you're doing CPR, you're trying to keep them alive, not kill them instantly. So, yeah, can be used. I don't think they teach that anymore. They used to. Now they don't. I don't know why. I'm not in charge. Doesn't matter. I'll be dead in a couple of years anyway. Who cares? And the xiphoid process is an attachment point for some of the abdominal muscles. We'll see later when we get to the muscles. Looking at the ribs now, they increase in length from 1 to 7, and then they get smaller. Remember, they form the cage. The head and the tubercle articulate with the vertebral facets. So look, and you can kind of see if you look carefully. I wish, if we were in class, I would have a vertebra and a rib, and I would walk around and show you a rib connecting to a vertebra. So what's going to happen is the head of the rib connects to the body of the vertebra. Remember the body, the big thick part of the vertebra? The head of the rib connects to the body of the vertebra, and then the rib has a little bump on it called a tubercle, and the tubercle connects to the transverse process of the vertebra. Like I said, there are really two joints. The rib connects to the vertebra in two places. The head connects to the body. The tubercle connects to the transverse process. The intercostal space, remember what does that root word costal mean? Costal means rib. So what is the intercostal space? It's the space in between the intercostal muscles. How much easier than that can you possibly get? I mean, what's big and red and eats rocks? A big red rock eater, right? Why don't blind people skydive? Scares the hell out of the dog. See, these are easy questions. Don't think too hard about them. Costal cartilage extends from the distal ends of ribs 1 through 7 to the sternum. Talked about that on the previous slide there. You see the costal cartilage, okay? Now let's zoom in and look at an individual rib. So look in the upper left, you can see the head and the tubercle. Head connects to the body of the vertebra, tubercle connects to the transverse process. Notice how the ribs are curved. See the place where the curve is sharpest, where there's the sharpest bend in the curve? That's called the costal angle, okay? Easy. Then running along the rib, there's a little groove called the costal groove. What do you suppose that's for? Sure, nerves and blood vessels, like we've seen. Depressions and openings are usually for a soft tissue of some sort, often nerves and blood vessels. Rib articulation. So again, articulation means forming a joint. So here you see what I was talking about. You see the tubercle of the rib connecting to the transverse process and the head of the rib connecting to the body. That double joint makes it especially sturdy. Think of the people who are playing football and hockey and stuff like that, slamming into each other at high speed. You don't want your ribs, and you do get broken ribs all the time. I had a broken rib once. That's really, really painful. I got that playing football. Broken ribs are painful as hell. Every time you cough or sneeze, you're doubled over in pain. But your body tries to protect you by having two solid joints there to protect and hold the rib in place. So the tubercle articulates with the transverse process, head articulates with the vertebral body. Oh crap, I talked over the transition again. I wasn't saying anything important, as usual. So let's talk about a herniated or slipped disc. So remember we talked about there was the intervertebral disc composed of the annulus fibrosus, the fibrous ring, and the nucleus pulposus, the soft, chewy center of the Tootsie Roll Pop. Okay? So what happens is sometimes if you get a little tear in that annulus fibrosus, you can get that through trauma. You slip and fall, you're playing sports, you get hit. Often happens when people are lifting things that are too heavy. So typically this happens in the lower vertebrae, in the lumbar and sacral vertebrae. So you get a tear in that annulus fibrosus and the nucleus pulposus starts to ooze out. So that's bad. Again, this happens mostly in the lumbar region, and what can happen is when that nucleus pulposus oozes out, it presses on the nerve. And down in the lumbar region, you have the largest nerve in your body, the sciatic nerve, which goes all the way down the back of your leg. Splits into a couple of nerves. We'll see later when we get to the nerves, we'll see what's going on there. But when the nucleus pulposus presses on the spinal nerve, in this case the sciatic nerve, that can cause a lot of pain. And that condition is called sciatica. Sciatica can be extremely painful. It causes people to have to walk with a cane. Sometimes they're even in a wheelchair. Surgery is often iffy. These things are kind of hard to repair, and sometimes people are actually worse after the surgery than they were before it started, okay? And what they can do in those cases is they do a laminectomy. So remember the lamina, the parts that form the arch there? So see the spinous process of the vertebra, then the roof coming down, the two lamina? What they can do is they can snip those. It's kind of an extreme measure, but then that takes pressure off the spinal cord and off the nerve. You're not going to be playing sports after they do that, probably. And in the lower diagram, you can see there, look, you can see the actual herniated or slipped disc. You can see the nucleus pulposus oozing out and pressing on the nerves down there. That can be very painful. As I mentioned before, the spinous process is formed by the fusion of the two lamina. Well, sometimes during development they don't fuse together and they stay open. And when they fuse together, not only do they form the spinous process, but they then form the vertebral foramen. They close off the hole. If they don't fuse, then the hole stays open, and the spinal cord can actually sort of float up to the outside of the body. And that's what you're seeing here. This is called spina bifida. So bifida, remember the two forks, basically bifida. So when the two lamina don't fuse together, you create an opening and the spinal cord can come out. It's a failure of the vertebral laminae to unite. Nervous tissue is unprotected, possible paralysis and other complications. Sometimes it's fatal. People don't survive birth. Other times they survive birth, but they're paralyzed from that point on. I had a guy in my class a few years back who was born with spina bifida. He was in a wheelchair. So he was, perfectly normal in every way. I mean, smart guy and very normal. Actually a very nice guy, but he couldn't walk. Spina bifida ended up paralyzing him from the waist down. So the curves. There are 4 curves in the vertebral column. It's not a straight line. There are 4 distinct curves. Look at them. Look at the diagram on the right. See them right now? There's the cervical curve, the thoracic curve, the lumbar curve, and then the sacral curve. Notice how they reverse direction each time. So the first one, if we recall that convex, and then the one below it, thoracic, would be concave. Then we would have convex again with lumbar, and then concave with sacral. So those 4 curves are supposed to be there. And there are disorders of abnormal curvature of the spine, and I want you to know those. There are just a few simple ones that I want you to know. So a cervical curve, a thoracic curve, a lumbar curve, a sacral or pelvic curve. We're going to say sacral. Those are the normal ones, okay? Now let's look at what happens if you have an abnormal curve. So first of all, let's look at an abnormal curve that's laterally. So this doesn't involve the 4 curves we just talked about. This is a side-to-side curvature. This is called scoliosis, a lateral bending of the column. There's both a C-shaped scoliosis and an S-shaped scoliosis. So it just depends on whether the whole thing is curved to one side or whether you actually get a ripple in there and it looks like an S. So that's scoliosis, a lateral curvature of the spinal column. Kyphosis is an exaggerated thoracic curve. So see in the middle picture, see how the woman has a hunched back, and that's the old informal name for kyphosis. They called those people hunchbacks. It was an abnormal curve of the thoracic region. Then finally, lordosis. This is an abnormal curve of the lumbar region, all right? Now you can see here they're showing a pregnant woman. This is somewhat normal in a pregnant woman because, that little parasite's, trying to pull the whole front end of your body down onto the floor. So it's normal to have a little abnormal bend in the spine during pregnancy. It should return to normal. But sometimes people can get permanent curvatures down there, and they have what's called sway back, is the old-fashioned term for it. Lordosis is what we're going to call it. So there you go. Normal, kyphosis, lordosis, scoliosis. These aren't hard. I want you to know them. They're easy. Here you can see on the left someone with severe scoliosis. That would be the C type of scoliosis. And on the right, we have the before picture, that's A, and the after picture, that's B. What do you suppose that's after? If you said surgery, no, that's after physical therapy. Don't ever doubt physical therapists. They know what they're doing. They can work wonders. What do we have here? That's kyphosis, that's the hunchback, and abnormal thoracic curvature. What do we have here? That's lordosis, swayback, and abnormal lumbar curvature. And of course, there was a very famous person with kyphosis. That was the kyphotic of Notre Dame. They call him the hunchback. So here are pictures of scoliosis before and after surgery to fix it. So I had a girl in my class a few years ago that had scoliosis like this, and they fixed it exactly this way. Look, they just go in there and they put in a bunch of screws and little plates and stuff, and they just straighten that spine out. She was really cool. She showed us on her back. She wore a top that would show the upper part of her back, and so we could see the scars where they had gone in and fixed it. And she lives a perfectly normal life. They were able to fix it so that she could get back to normal. Okay, we really are done with the axial skeleton now. Next, we will start on the appendicular skeleton.